For our county assessment project, Team D is focusing on Desha County, identifying areas for improvement and adopting new policies to improve public health there. For our county assessment project, Team D is focusing on Desha County, identifying areas for improvement and adopting new policies to improve public health there. First, some history of the county. Founded in 1838, Desha County was a slave-holding county which produced cotton, and after the Reconstruction era and the rise of cotton commercialization, the population began to decline and wealth began to leave the area. Some efforts are being made to revitalize and attract new citizens by highlighting the county's historical significance and its outdoor recreation opportunities, but the population remains, on average, rural and impoverished, with an average household income of $32,000 per year. Demographically, Desha County is a majority Black, with the white population declining since 2000. This is in contrast to a number of other counties assessed, including Craighead, Jackson, and Pulaski counties, in which the majority is white. Minority groups, including Asian, Hispanic, and Native Americans, make up a much smaller quotient of the population, no more than 10% of it combined. In terms of health status and outcomes, Desha County is also notable for the highest percentage of low birth weights of the assessed counties, trading off with Lafayette County. Low birth weight is a condition with several associated comorbidities, both in the neonatal period and later in life, with adults having higher rates of depression, ADHD, and other psychiatric conditions. Indeed, Desha County does have a higher than average percentage of adults who report mental. For our county assessment project, Team D is focusing on Desha County, identifying.
Health insurance coverage in Desha County is 90.7%, with the population having some form of health insurance. However, 9.28% of the population is without coverage. When we break these numbers down, 31.9% are covered by employee plans, 31.2% are covered by Medicaid, 15.3% are covered by Medicare, 10.7% have individual plans, and only 1.62% of the population is covered through a military or VA plan. The ratio of patients to primary physicians is 1,894 to 1, and the ratio of patients to mental health providers is 1,389 to 1.
Part of our county assessment, I collected statistics about Desha County's facilities, as well as miscellaneous statistics about the residents' reported quality of life. According to Arkansas Hospitals Organization, the total Arkansas hospitals are 113, with Desha County having 2 of those hospitals. The average number of hospitals per county is about 1.4, but Desha County's facilities are the Delta Memorial Hospital and the McGee Hospital. And when doing my research, Delta Counseling Associates, Inc. was the only reported mental health facility in Desha County. So for my next bout of statistics, I picked miscellaneous ones that, using the 2023 County Health Ranking National Findings cited in our bibliography, I pulled quality of life data about Desha County, and most notably, all of these statistics, smoking statistics, alcohol impaired driving, deaths, unemployment, poor mental health days, poor physical health days, reflect Desha County as being in a higher need of mental health intervention than the Arkansas average, which brings us to the introduction of our actual policy. So the central concept of this project is for enhanced mental health access in Desha County. Our overarching goal is to implement funding, education, and accessibility programs to the Desha County healthcare system with the goal of bettering mental health availability to residents. So our policy would designate funding and encourage projects to be created via a 3-pronged approach: the incentives for mental health care professionals, education opportunities for Desha residents, and telehealth infrastructure development. So we'd attempt to acquire this money from both federal and state sources that we could distribute to programs who support these prongs. For example, we could partner with the ARHP and other means that we'll speak of later in the program.
For our county assessment project, Team D is focusing on Desha County, identifying areas for improvement and adopting new policies to improve public health there. First, some history of the county. Founded in 1838, Desha County was a slave-holding county which produced cotton, and after the Reconstruction era and the rise of cotton commercialization, the population began to decline and wealth began to leave the area. Some efforts are being made to revitalize and attract new citizens by highlighting the county's historical significance and its outdoor recreation opportunities, but the population remains, on average, rural and impoverished, with an average household income of $32,000 per year. Demographically, Desha County is a majority Black, with the white population declining since 2000. This is in contrast to a number of other counties assessed, including Craighead, Jackson, and Pulaski counties, in which the majority is white. Minority groups, including Asian, Hispanic, and Native Americans, make up a much smaller quotient of the population, no more than 10% of it combined. In terms of health status and outcomes, Desha County is also notable for the highest percentage of low birth weights of the assessed counties, trading off with Lafayette County. Low birth weight is a condition with several associated comorbidities, both in the neonatal period and later in life, with adults having higher rates of depression, ADHD, and other psychiatric conditions. Indeed, Desha County does have a higher than average percentage of adults who report mental health distress, with poor mental health affecting roughly 21% of polled adults for at least half of a given month. This mental health concern is what my team hopes to address with our three-pronged policy approach. This mental health concern is what my team hopes to address with our three-pronged This mental health concern is what my team hopes to address with our three-pronged policy approach. So the first critical component of our mental health professional recruitment and retention initiative is the financial incentive program. This program is designed to attract and retain mental health professionals in Desha County, ensuring that we can provide the necessary support for our community's mental health needs. Let's take a closer look at the elements of this program. The first tenet is student loan forgiveness. We understand the financial burden that comes with education, particularly in the healthcare field. To alleviate it, our program will offer assistance with the repayment of student loans. We would work closely with local universities, including the U of A, as well as federal and state relief plans such as Public Service Loan Forgiveness and National Health Service Corps to promote loan forgiveness policies similar to rural medicine programs available to some PCP physicians. By doing so, we encourage mental health professionals to consider serving right here in Desha County. The second is housing assistance. We acknowledge that relocating to a new community can be a significant challenge. That's why we would also work with local and state initiatives to provide support for housing costs. This assistance makes the transition more manageable for providers who choose to work in this community. The third part of it is tax incentives, because we also recognize the importance of reducing.
So the second prong of our policy is the education initiative. And the objective of this is to provide resources to further destigmatize seeking mental health services while duly encouraging Desha residents to enter mental health adjacent careers. So there's two parts of this. The first is public education to destigmatize mental health services. If we're striving for this improved mental health for Desha County residents, we have to make sure the public is on board and that they understand our mission. We can do this via an awareness campaign. We can go about fundraising, drawing in the library system, specifically the Southeast Arkansas library system, and they can include flyers, speakers, displays, events that we can help fund for people who decide to implement those, as well as we can reward school involvement and workplace involvement that decide to jump on board with this policy, as well as academic partnership becomes the second avenue. So in order to not overwhelm the field, we want to encourage new professionals. Encouraging these new professionals is essential. As we've discussed in our previous portion, incentivizing professionals to go to this area, as well as for this portion, bringing new professionals from Desha County itself. So that way we can partner with schools like UA Monticello, which has a program in social behavioral sciences, psychology, and social work. And if we partner with them and encourage Desha County residents to seek further education in these fields, we cannot overwhelm the already currently existing mental health facility there, and we can bring in more awareness as well as more active professionals in the field, both for the school and for the county itself. It has mutual benefits. And that actually ties into, when we're talking about benefits, the stakeholder engagement plan. So our primary stakeholders are the Desha residents. All demographics benefit from mental health services, but it especially benefits mentally struggling residents and students and people seeking a higher education. So our secondary stakeholders on that end, we have educational facilities, so UA Monticello, where we can talk about expanding their program via, again, more funding from our state and local levels, promotion for those programs, and higher numbers, higher students. The more people they bring in, the more money they make, so that can be mutually beneficial to follow our policy and to work with us on that, as well as partnered organizations where they can get publicity and community involvement. Think of the library system there, but as well as other organizations that decide they want to work with our policy can be rewarded through, again, publicity and just general betterment among the community and community involvement. And other mental health providers, they're a secondary stakeholder where we are increasing their patient numbers while lessening the burden on current providers by bringing in more professionals through the academic partnerships. Specifically, if you're thinking about the Delta Counseling Associates, Inc., that only mental health facility that is registered in that area as a sole mental health facility, this benefits them in the long run as well.
With telehealth infrastructure development, our objective is to improve access to mental health care and enhance the overall well-being of the Desha County community. Its key components are increasing access to care, making care more convenient, and providing additional support to existing providers. The primary stakeholders are Desha County's residents. They will directly benefit from the new telehealth mental health services, becoming the primary beneficiaries. Telehealth allows them to actively engage, participate in receiving mental health services, and even self-manage ongoing care. Second are the local healthcare providers. They are able to identify community needs and can educate patients with telehealth services. Providers will be access points for telehealth services, offering support, monitoring progress, and providing emergency assistance when needed. Secondary stakeholders. The secondary stakeholders are the local government. They are responsible for the necessary infrastructure development to establish and maintain the technology needed for telehealth services. By engaging with the local community and healthcare providers, they can advocate for policy changes that support the widespread adoption of telehealth services. Second are the insurance companies who are involved in the reimbursement process for physicians providing telehealth services. With their involvement, they can benefit from improved patient outcomes. They can also actively participate by aiding in eligibility and coverage for services, ensuring that this approach is financially sustainable for all stakeholders. In conclusion, our proposed healthcare policy for Desha County represents a strategy to tackle mental health care access in the community by addressing mental health concerns through a three-pronged approach: incentives for professionals, educational initiatives, and telehealth infrastructure development. The aim is to increase a more accessible mental health support system. The Mental Health Professional Recruitment and Retention Initiative not only makes Desha County an attractive destination for mental health professionals, but also ensures a sustained presence. The educational initiative plays a role in changing the narrative around mental health, emphasizing its importance, and destigmatizing seeking help by raising awareness and engaging with local educational institutions. The telehealth infrastructure development aligns with current healthcare trends, using technology to improve access and convenience for residents. This initiative recognizes the role of local residents and healthcare providers as primary stakeholders, emphasizing their direct benefits from available mental health services and access to care. If successfully implemented, these initiatives have the potential not only to improve mental health outcomes, but also to contribute to the overall well-being and resilience of the Desha County community.
For our county assessment project, Team D is